Hi, I'm Dr. Katrina Couchman and I work as a GP Clinical Editor for HealthPathways South Australia. In this short video, I'm going to show you some examples of how you can use HealthPathways at the point of care during your consultations. I see this website as a key online resource for GPs working in South Australia. HealthPathways is a comprehensive yet user-friendly set of guidelines regarding the assessment and management of the conditions which will walk through your door every day. We have pathways on topics such as chronic pain, acute otitis media, COPD, reflux, sleep apnea, falls prevention, asthma, anxiety and depression, and constipation in children, just to name a few. We are continually adding to these pathways, so make sure you check back on a regular basis to see what's new. What I like about these pathways is that they are written in user-friendly dot points, so you can quickly jump into a pathway while consulting with a patient, just in case you need to check something. Here are some examples of how you could use health pathways while consulting. Say you can't get your head around all of the details of the new cervical screening program and wonder who really needs a co-test and what follow-up is required for different results. Never arranged a self-collected specimen before and not sure what to do? Just check the cervical screening pathway on HealthPathways. Or say you're consulting with a patient who you suspect may have medication overuse headaches. We have easy to use step-by-step guidelines about how to manage that. Looking for a framework for the assessment and management of chronic pain which has been developed with a South Australian pain specialist? Just jump on HealthPathways. All of the pathways have been edited by a South Australian GP in conjunction with a South Australian subject matter expert. The pathways also go through a wider consultation process with a multidisciplinary group of clinicians working in the area. So you can be confident that the guidelines are an up-to-date and reliable source of information and they take our context here within South Australia into consideration. We really value your feedback too. If you want to provide feedback on one of our pathways, please hit the Send Feedback button on the site at any time. The other great thing about the pathways is the section down the bottom called the Request section. This is where we outline the recommended referral pathways within South Australia. Not sure about all of the services in your area that can provide support for suicide prevention? Check the Request section of the Suicide Risk Pathway. Not entirely clear which patients with reflux really should be referred for an endoscopy? The Request section has the criteria all clearly outlined. Wondering what the criteria are for patients wanting to access bariatric surgery in South Australia? Look at the Request section in the Healthy Lifestyle and Weight Management pathway. The Request section also includes referral criteria, for example, any inclusion or exclusion criteria, and phone numbers and fax numbers you will need to make your referral to service providers, including other specialists and allied health professionals. If a service has a specific referral form, we will include a link to the form. This can really save you and your practice staff valuable time. Finally, at the bottom of the pathway in the information section, you will find patient handouts, so you can just click and print. We also have some educational resources if you wish to update your clinical knowledge on a particular topic. Our team have done all of the hard work for you in terms of locating the best patient and clinician resources. I hope you find Health Pathways to be beneficial to your practice. To get registered, just Google the Health Pathways project site where you can register for a login. Jump online today.